Okay, Assalamu alaikum and good afternoon, good morning to everyone. Thank you very much for joining this PBL session. This is the second session on PBL. The first one was on the development of a PBL package, which we did about 2 months ago. In this one, we are going to talk about the process and roles and responsibilities of the facilitators and students in the PBL. Let me make it full screen. Okay. Okay, the learning outcome of these sessions will be that after attending this session, the participants will be able to facilitate a PBL session following the prescribed roles and responsibilities of the facilitator, apply the strategies to help students to create their knowledge in conducive environment by using clinical cases or triggers, and promote critical thinking and reasoning skills in students to be self-directed lifelong learners. We all know that the PBL is a constructive, self-directed, collaborative, and contextual learning. Constructive because we construct on the previous knowledge. Self-directed because the students are responsible for all the learning which they are supposed to do in this. Collaborative because the students work with each other as a team to achieve those learning outcomes. And contextual because whatever is there, the cases, they are real cases, and the learning is in context. This is not something which they are not going to see in future. The cases which are selected for the PBL are usually those which they will be seeing as a doctors when they graduate. The knowledge in the PBL is socially constructed, means it is a group activity, but it is under the guidance of the facilitator. And while doing this, we deal with the authentic problem, which is the real case from the hospital, but the case is tweaked, pruned to fulfill the requirement of the learning outcomes which are to be achieved in the session. Students should have the ownership of the whole learning process, and they should, for that purpose, take the responsibility of the learning. The PBL has, if the students become more involved in the learning process, the PBL shows significant strength in enhancing the student learning outcomes. So practically, the student learning outcomes, how much they are achieved, depends upon the enthusiasm of the students and how much they are involved in the learning process. In the PBL, learning is not unidirectional, like in the lectures in which only the teachers are talking. The role of the facilitator is different than the role of the teacher. The facilitator is the member of the team. He is not a teacher but a guide and has a less control over the activity. So most of the activities which are done in the PBL are actually done by the students, and they are responsible for all those activities. To run a PBL system successfully, we need more resources, more effort and time, not only by the teachers, but also by the students. So it is a very resource intensive sort of a program. And if the faculties and if the universities are investing in this process, that means that it has a value in the learning of the students. A lot of resources, the physical resources are required, and a lot of effort goes of the facilitators in the development of the PBL package, for example, in sitting in as the guide in the PBL sessions and evaluating the students in the PBL sessions. The motivated teachers play a key role in effective implementation of the program.
Just a minute.
I'm sorry, there is some technical flaw. We'll sort it out in a minute.
Quite clear.
It is. The motivated teachers play a key role in effective implementation of the program. Everybody can listen?
Roxana, listening is no problem, but there is echo. There is problem with your mic system. So what we suggest is this, that you operate only one Zoom device in your room where you are sitting. Thank you.
Okay. Hello. Hello.
Ma'am, we can hear you.
Is there an echo?
No, now it's ended.
No, it's better.
Fixed.
It's fine. There is no echo.
Okay, thank you very much. Thanks a lot. Okay, so I was on the introduction of the PBL. The PBL is not unidirectional. The role of facilitator, or however, is different from a lecturer. He's a member of a team, is not a teacher, and has less control over the activities. Okay. Can you listen me now?
Yes, ma'am.
Yes.
Amna, you can.
Yes, ma'am. We can hear you and it's clear now.
Okay, thank you very much. Motivated teachers play a key role in effective implementation of the program. Okay. The facilitative guidance plays a direct role in the group performance, including learning from the peers. It has been proved by Bhattacharya in 1998. Now we're going to talk about the facilitators' roles and responsibilities. We as a facilitator guide the students in their learning, elicit higher order thinking, challenge and motivate the students, and monitor the group dynamics. The first one, guide the students in their learning. How can we do that? We guide the students step by step through the process. We ensure that the student approach the problem appropriately, encourage discussion, and goes up to the Bloom's taxonomy level 3 of analysis, synthesis, and evaluation. Involve all students in this discussion. No student should be left alone in the PBL session. Encourage students to review and redefine their explanation as they go through the process so that the hypothesis might keep on changing over the time. Make sure that the discussion is not unnecessarily lengthy and help the students in setting the minimum learning needs. It is very important that the students should be able to achieve at least the minimum learning needs, which are the must-know learning needs of the session. Assist students in identifying the resource materials. The list of the resource material is provided to the students, but where these resources are located, sometimes the students need help. For example, the anatomy resource room, the material which is available in the pathology museum, the slides which are available in the histology lab, etc., etc. Know when to tell and how much to tell is very important for the facilitator to know, because the facilitators are not supposed to teach over there, and whatever amount of information they are going to give has to have some significance of some relevance for the student. Elicit higher order thinking, scaffold learning for the initial few weeks of the students when they are new. Foster learning in the ways that demonstrate understanding, not merely the recall knowledge is learned by the students. They should be able to demonstrate the understanding of the content they have learned. Challenge the student in assumptions, ensure that they reflect on and justify their assertions. Probe further, referring back the questions, comment, and suggestion to stimulate thinking. Nurture the clinical reasoning process. Prepare the student to think critically and make informed decisions. Help students to define problem and seek solutions. Comment on the quality of the argument presented. It is very important that the student gets the feedback on what was the quality of their discussion, so that they can improve further during the next session. And commitment to student directed lifelong learning is very important, that yourself is committed that yes, this is the student centered learning opportunity, and the student should take the responsibility of their learning, and in the process they will become the lifelong learners. Give regular and constructive feedback to the students. Challenge and motivate students. How to challenge and motivate students? Expect and communicate your expectations to the students to be responsible. Listen very attentively and actively to what the students are saying. Ask open-ended questions to stimulate deep learning. Stimulate debate about the major issues that will encourage the students to have an open discussion. Continuously evaluate their achievements and guide them how to improve on that. Encourage critical thinking through reasoning, evaluating, and analyzing and decision making. Ask students to provide evidence for their statements. Whatever they are saying, what is the evidence, from where they have got this information. This way the students will learn the evidence-based medicine, and they will know that how important it is to get to the real resources. Challenge students to link theory and practice. Let the students lead and make the decisions. So relax, the students are much capable of doing that, and they will lead and make good decisions. Give feedback to the team on their performance, acknowledging the high level of performance or challenging them to improve. Monitoring the group dynamics. Set clear goals at the beginning of the sessions. When you meet the students for the first time, say in the beginning of the year, set clear goals at the beginning of that time. Maintain discipline by setting and implementing the ground rules. Both the facilitator and the student help to set the ground rules, and they should be implemented by both the parties. Encourage group interaction, reinforcement, and agreement. Encourage communication and team building skills. It is very important that the students communicate with each other so that you know what is going on in between the students. Monitor sharing of the workload. Prevents the dominance of some students. Act as a gatekeeper and timekeeper. It is very important that the students don't come late or not absent from the sessions. In most of the universities in Malaysia, if the student is absent, they have to give a reason why they were absent for the PBL, because it is a compulsory session they have to attend. And the timekeeper is not to let one student keep on talking and the other students are waiting for that student to stop. So you should make a rule that all the students need to participate and need to give their input. Help in consensual decision making. Support the team management. Create supportive climate, encouraging the involvement of all students and addressing the group problems as and if they arise. Hence, the responsibility of the facilitators are to focus on the process, ensuring no step is missed. Remember that in the PBL, all the processes, all the steps of the processes have their significance and have their objectives. And if the process is missed, practically the whole process of the PBL will go haywire. Focus on promoting student interaction, discussion, and keeping the discussion on track. Make sure that the student approach the problem appropriately. Make sure that the minimum learning outcomes are identified. Help to find the resources. Maintain friendly and cooperative atmosphere. Maintain the discipline. Solve any administrative problems if they arise. Give regular and constructive feedback. And the last point, which I put with an exclamation mark, is the explanation facilitators as chairperson. Personally, I have not seen any university, the 4 universities in which I have worked, facilitator becoming a chairperson, but it has been documented that they can take this role. We would like to have a feedback from the participants if they are doing that, how they are managing it, because if the facilitator becomes a chairperson, it has its positive points, but probably it is a bit detrimental for the PBL process itself. What are the facilitation dilemmas which you can face? this is the point, this is the tricky point in which the facilitators are a bit scared to facilitate. What if the student learn their own bit? So what you can do is that you can focus on discussion, not on the presentation. The presentations actually make the students learn only their bits. So the focus will be on the discussion. Emphasize must know and good to know learning needs. Randomly ask the student to start a discussion so that the divide and the rule approach they are using is not functional anymore. Encourage group involvement. Ask the group members all to be involved. Ask others to contribute. What is your idea about it? Do you have any more information? Or worst come to worst, summarize. The shy students which will not come for any discussion, you can ask them to summarize the discussion. At least in that way, you will know how much they have learned. From the administrative side, the length and complexity of the problem is controlled to avoid divide and conquer effort. If the PBL package is too lengthy, they have to have number of learning outcomes, and if the PBL is being conducted near to the examination, usually the students tend to take the shortcuts. How to bring the missing learning outcomes? Don't hasten, just wait for them. I've seen that the students who have missed important component in the first session will pick that up during their in between session, and they will discuss that in their second session. So don't be worried that they are going to miss. At some stage they will recognize that they have missed something and they will come to it. Probe them to think. Suggest that all ideas are welcome. Sometimes the students know that something is being missing, but the shy type of students or the students who are not very conversant with the English language, they will hesitate. So ask them that all ideas are welcome, and they can speak up the things whenever they want to. Ask questions rather than making statements. Should facilitator answer a question? Don't provide direct answer. Direct the question to the floor. Ask the other students to give the answer. If the information is crucial for the continuation of the process and nobody is responding to it, just give a hint of it. Take a pause and ask the student you can take a timeout and ask the student to quickly look for that information. Everybody has a phone. They can switch on their phones again and then they can get this information quickly. Should facilitator ask a question? Yes, to stimulate discussion, to provoke, if not to assess, but not to assess the knowledge. To keep the group focused to achieve the objectives. Enhance the learning skills in the students by asking what is the rationale, for example. Direct towards the missing learning outcome. How to clarify the wrong concept. The students have been discussing thoroughly. It was a very good discussion, but the concept was wrong. What to do then? Ask probing and provoking questions. Ask students to explore this as the learning issues. Guide to appropriate resources. What if you don't know the answer? This is the worst dilemma for the facilitator. Student have asked you something and you don't know the answer. Be sure that the facilitators are not expert of all the disciplines. You can be an expert of one discipline, maximum 2 disciplines, but you cannot be the expert of all disciplines, and you wouldn't know the answers of all the disciplines. And as the facilitator becomes clinicians, they know more of the clinical and they don't know the basic sciences, most of them. Sorry for that. So you're not responsible to have the knowledge of all the things, but you are provided with the facilitator guide. So it's good to read the facilitator guide to get some confidence. Don't hesitate to acknowledge that you don't know or you forgot. Be a part of the team to search for an answer together. If the issue is something which you think that it is related to, for example, to your discipline, but it is not yet available in the books, and the students are still searching for it, you can ask them that we are going to do this search together, or direct the students to the discipline experts to get the further information. When it is necessary to intervene, when there is an apathy or lack of meaningful interaction between the students, when there is a limited or focused or lengthy discussion, when there is a disrupting group member, when there is a forgotten student, when there is a dominating student. So how to manage a quiet student, the student who is shy and who is not talking at all, who is not participating at all. The best thing will be to request other students to engage them in discussion. This goes through the chairperson to the other members of the group, and they will ask the student, they will encourage the student to engage in discussion. Ask all students to report back their learning. So this is not generally practiced, but it is in the literature. What is being done over here is that the students, whatever they have learned, they make a portfolio of it, and they provide this portfolio to the facilitator at the end of the session. And by looking at the portfolio, you can gauge whether the students who are quiet are really lagging behind or they are learning. So probably they are quiet because they are not good in their communication, but they are still good learners. So you can have a rough idea of it. And if you need to intervene, then you can intervene in that condition. Ask them to summarize the discussion, encourage them to share their ideas. Give them time to organize their thoughts, because if they are deficient in the language, then probably they have to make a sentence in their brain and then to speak it loud. So give them time to organize their thoughts in answering. Don't give your feedback in a hurry. Arrange a meeting with them and discuss with them the issues first. How to manage a dominant students. The dominant students are usually the good students, so you don't want to dampen their enthusiasm as well. So politely tell them that they all have to share the points. So if there is a topic or concept which is being discussed, everybody chip in into that discussion one by one. Indicates that there is a time pressure and the other people are also in the queue to give their input. Engage the chairperson to involve all. Ask all students to give feedback about their and others' contribution. In that situation, if the students give the feedback that they cannot talk because of the dominant student, then the dominant student probably would know that he has to or she has to limit their inputs. Have a personal discussion with the student if the situation becomes very, very worse. What are the students' roles and responsibilities? The role of the student is as a chairperson. The role of the student is as a scribe, and they function as the members. As a chairperson, one student in a group will act as a chair for one PBL case. So if the PBL case comprises of 3 sessions, for all the 3 sessions, that same person will remain the chairperson. The aim is that at least each student should be a chairperson for one of the PBLs. So there are about 10 modules in a year. So, and if there is a maximum of 10 students or 11 students, at least everybody get the chance to be a chairperson at least once. The main function is to assist in providing structure to each sessions, ensure that the ground rules are followed, punctuality, discipline, etc. Invite participation by all, summarize the discussion, check for agreement on learning issues, make consensual decision making, and provide positive reinforcement and encouragement to the students. They also will help in maintaining the group dynamics, foster respect and good communication. Everybody has the right to expression, avoid the conflict in the group, and take care of the dominant and lost members. Actively contribute in discussion and identify the learning needs. So the chairperson is not the boss. Doesn't mean that they're not going to participate in the discussion. They have to actively contribute in the discussion and in the identification of the learning needs. And in this process, they should avoid always talking first, because they are the chairperson, and not making long speeches again, which is just a characteristic of being a leader. As a scribe or a recorder, one of the students in the PBL group usually act as a scribe for one PBL course, working closely with the chairperson. In the literature, it has been recommended that you can have the 2 scribes as well, because sometimes the process of scribe is such that the discussion is going so fast that one scribe cannot really follow it properly. So 2 scribes can be appointed for one PBL. Their main function is to record the key components of the discussion legibly on the board or the flip chart, whichever is being used. They help the group to order or link the points, ask for clarification if some confusion is there and you are not sure of what they are discussing and what you are writing is clear. Keep a list of the learning issues which have been identified and record the learning agenda and circulate if asked by by the group members. When we are using the whiteboards, usually you can get the printout of the whiteboard, the all information is there. We can ask the student also to take a picture of that whiteboard if you are not sure that the information which is on the whiteboard will be available when they come for the next session, so that they can take the picture, and the whole situation, what happened in the last session, will be known to the students later on. They can have that recall of the memory. Link all the formal and informal sessions, act as a channel for communication between sessions. Ensure that the all writing material is available, the markers, the whiteboards, blackboards, flip charts, whatever is required is available. Involve in discussion and also help in the identification of the learning needs. Like the chairperson, they are also the member of the team, so they should contribute to it as well. As a member, the professional behavior of the student is very important. Communication skills, speak directly to the group, keeping an eye contact, easy flow, identify misunderstanding and attempt to resolve it, recognize and respond to nonverbal communication. Be respectful, neither rude or arrogant, nor patronizing. Allow others to express their opinions and share information. Acknowledge the contribution of others, say thank you and apologize for your own shortcomings, say sorry. Be responsible, be punctual and complete the assigned tasks which are given, and if you are not able to do it, negotiate the alternative of it. Self-awareness and self-evaluation, difficulty in understanding and lack of appropriate knowledge. If you identify it, then you know that you have to improve on those things. Discomfort in discussing or dealing with a particular issue, or respond to fear negative evaluation without being defensive. As a member, learning to learn, assume high degree of responsibility for own learning through STL, self-directed learning and student-centered learning, and working with others, collaborative learning. Participate actively in the discussion, advance discussion by responding or expanding the relevant issues. Develop flexible understanding. You shouldn't be stick to the point that the way you have understood it, maybe the other person is telling you a better explanation. So you should be flexible in understanding and in the lifelong learning skills. Help setting relevant learning needs for self and the group. Work on all the learning needs either alone or with the friends who might not be the group member. So this is very important. When the group is being formed, that doesn't mean that every activity will be with the group. In between the two sessions, you can study, the students can study alone, or they can study with their friends, which might not be in the same group. But when they do the in-between discussion, they should be with their own group. Actively search for the answers, share information with the group during group discussion, create and recreate knowledge together through dialogue as it leads to deeper understanding of the issues. Monitor personal contribution and reflect on their input, and this is for the students. So they should be reflecting on their personal contribution and reflecting on their input. As a member, this should involve in the team building, follow the process of PBL session in sequence. It is very important. This point will come again and again. Take initiative to help to maintain the group dynamics. Comment on the contributions of others positively. Give good comments. Challenge each other, but respectfully. Don't agree just for the sake of agreeing. This will lead to complacency. Be aware of personal behavior, tendency to dominate, speak over people, reluctant to speak in group. Think how behavior affects a group activity and the achievement and try to modify it. Give contribution during in-between activities of the group. Exhibit friendly and the cooperative attitude. Be sensitive to the religious and cultural issues of the group members, especially so in the communities which are multi-religious, multicultural. Identify the misunderstandings and attempt to resolve them as quickly as possible. Hence, the responsibility of the students is to be prepared for the PBL, attend the interactive sessions and the workshops which are conducted during the introduction week. I'll come back to this point later on. Shoulder accountability, be punctual and considerate. Active participation, identify, analyze problem and generate hypotheses. Ask question, be inquisitive. Look for answer through the resources to define your understanding. Share information, work together and come prepared. Link theory to the practice, correlate whatever you have learned to the trigger patient. It is very important. Most of the time the students are so engaged with learning that they totally forget about what was there in the trigger. Make decisions, maintain group dynamics, foster professional attitude, competence and confidence, evaluate interdisciplinarities, team process as in real situation, have fun while learning. This is the most important point, that you should be enjoying the session, not getting bored and think that it has been forced onto you. What could be the group dilemmas? The teamwork. There can be a small group dysfunction. Hitchcock and Anderson have provided a list of the causes of small group dysfunction, which includes unprepared for the session, late or absent from session, quiet or shy students rarely contribute. They are called as free riders. Dominant students try to control the discussion and don't let other talk. The student belittle the psychosocial aspect of case. They think this is not important. So make sure that the students are aware of the importance of the biopsychosocial model of the learning. Disorganized clinical reasoning process, which will lead to uh, uh, bad hypotheses, and they will not be able to find the real causes for the problems. They expect the facilitators to provide the answers. There is a lack of commitment, apathy, or lack of meaningful interaction between the students. The personality clash between the students in a group, if this type of situation arises, it should be resolved as quickly as possible. Superficial studies, the students just go through the session without going into the deep learning process, which defeats the purpose of PBL. They keep on storming and they don't come to the conclusion and waste a lot of time over there. So they have to be careful about that. They shortcut the duration of sessions. Usually the session is 2 hours and you have missed few of the steps of the PBL process and the students are roaming outside 1 hour later, for example. This is commonly seen in some of the groups in different situations, or they rushes through their activities. And the worst of all is the lecturing facilitator. The facilitator actually disrupts the whole of the group teamwork by giving the lecture to the students about the learning issues and all that. The group dilemma, the facilitators, should all the facilitators be medically qualified? The answer is no. All faculty members can bring in their experience and perspective, but all should be trained to be the facilitator and know the process, because they are not going to give the input in the content of the discussion. So you don't need them to be medically qualified or subject expert over there. Should facilitator provide all the trigger to students before the session to come prepared? There was a time when the students kept on asking for these things, that why don't you provide us all the triggers so that we can we come prepared with them and the PBL becomes much more easier. No, it defeats the purpose of PBL to learn how to deal with uncertainties, the teamwork, sharing and caring, communication skills. So there's a lot of things, the attributes, the characteristics of the PBL which are lost if we do that. How should students react to mini lectures by facilitators? Okay, this is a bit tricky, but you have to tell the facilitator about it, discuss as a team and let the facilitator know that you want to learn it by your own effort. And they will ask you, and they're going to ask the facilitator for help as and if required. Is there a standard format for facilitators to follow? Why different facilitators conduct PBL in different ways? This is also a very important question. The important thing is that it is not the facilitators who run the show, it is the students who conduct the sessions, not the facilitators. So for example, if the clinician is there and the clinician is giving all the good things about the clinical presentation and all the fancy things over there, the students are going to like it, but that is not a proper way of conducting a PBL session. The facilitator input for the content is supposed to be minimal, if any. And most of the process is being done, and the process is being conducted by the students themselves. Individual students, the quiet students, find their areas of expertise and consult them to give that opinion.
give them time to answer, listen to and value their contribution. This is the students doing for the students. Previously, what we talked about was the facilitator doing for the students. So for the quiet students, the other students will find their area of expertise and consult them to get opinion, give them time to answer, listen to and value their contributions, ask question before the time of session, before the start of session to break the ice. This is the strategies which have come up in one of the studies which have been done by Seven Bijan in 2000, in 2000. Comfort non-practicing students in a non-judgmental way. The dominating students make the ground rule that everybody talks on turn, rotating the chairpersonship among all the students so that the chairperson can contribute and control in a better way. Every students get equal opportunity to be heard, asking them to listen to others without interrupting, and set time for each contribution by Henry 2003. These disruptive students are those which are mischievous students in the class. They will be using their phone, they will be making some drawings, they will be cracking some joke with the students who is sitting next to them. And in the process, they are disrupting those students and their thought process. So the best thing would be to assign them some responsibilities and ask for contributions. The student can give them the responsibilities, find their area of interest and give them more opportunities in their area of interest, involve them in decision making so that they can feel themselves to be important. The process of PBL, journal organization. Students are divided into small group. In Malaysia, usually the groups are 7 to 11 in number. I know yesterday Dr. Kwan said that it should not be more than 10. Unfortunately, we have 11. Any number which is less than 7 or 6 will be a very small group, and if 1 or 2 members are dysfunctional, that means that practically 50% of the students are dysfunctional. But if the group number is 11 and if the 2 members are dysfunctional, that means that the 9 students can still steer the small group session well. Each PBL group has its own room, which is equipped with round table and chairs, lockers to keep the books, etc., and projection facilities. That was the requirement which was said previously, but nowadays, because the universities, they share their resources, so practically the own room is not there. The seminar rooms are shared by different faculties as well. So the lockers are still available in the rooms, and each faculty has their own locker, so the students can put their thing over there, but they don't have their own personal rooms anymore. So whatever is being written on the blackboards or the whiteboards, the students need to take the picture of it for their reference. And the projection facilities are no more available because the overhead projectors are no more in use, and usually the universities don't provide the LCD projectors for PowerPoint presentations. Each PBL has a minimum of 2 sessions with 1 independent study period. Some PBLs have 3, while others may have several sessions on a larger problem. There should be a gap of at least 1 day between the sessions so that the student can prepare the learning outcome. And if the PBL is so short that it finishes in 3 days, make sure that the length of the PBL is not too much. There is 1 facilitator per PBL team, or there is 1 or more roving tutors moving between 2 or more groups. If the number of facilitators is less, a facilitator is assigned to a group for ample time to develop a strong functional group. So if you keep on changing the facilitator with each PBL, the team building process will not be that effective. So usually the facilitator is assigned for, say, 1 semester, in which there will be 5 or 6 PBL, the modules will be conducted. However, if the university is following the ruling that there will be a PBL every week, so there is a module of 6 or 7 weeks, and every week there is a PBL session, then 7 weeks is enough to develop a team build, to build a team during that period. So it depends upon how many PBLs are done and how many facilitators are available. Attending workshop on facilitation skills is compulsory, and sitting for at least 2 PBL is prerequisite for the facilitator to be an independent facilitator for a group. Ideally, a facilitator should not change during one PBL. That is, there is one facilitator in one session, and then they have some more work to do, some academic work to do, and then somebody else is replacing them. That will not be good for the group functioning. Facilitator meeting is held few days prior to session to understand the case and to strategize the input. This is the requirement, and it is being conducted quite regularly in different faculties. The main aim is that all the facilitator actually knows what are the things they have to discuss, and what are their priorities for the PBL. For the students' first ever meeting during the orientation week, during the orientation week, a workshop is conducted for the student, which is a PBL on a PBL. So they are given information on the philosophy of the PBL, the concept of the PBL, the characteristics of the PBL, and then a PBL is given to them, and in that PBL is on PBL. So they have to collect more information about the PBL, which they will discuss towards the end of the week, end of the orientation week. The objective of the PBL process are explained to the students through interactive sessions, the knowledge, the basic and the clinical content in context, the skills, scientific reasoning, critical appraisal, information literacy, saga-directed lifelong learning. These concepts are pretty new for the freshers, so they are involved in the discussion of these interactive sessions. The attitudes, the teamwork, interpersonal skills, and the psychosocial issues also become very important part to make the students aware of. Ice breaking is get to know each other. This is the first time when the facilitator and the students, they are meeting with each other. Get to know each other, reduce the anxieties, develop group dynamics, and develop regard and respect for all members. It is very important to break the ice. And the ground rules practically are developed during this session, in which they clarify the group expectations, develop group dynamics, and develop transferable skills through these ground rules. Then there are the steps of the PBL process. The steps generally are the same, with the slight modification in what the students will be doing in different stages. Exploration. The first is the exploration of problem and clarification of the term, going to identification of the key problems and issues. From those the key problems and issues, you generate ideas and brainstorm the explanation. Then you go to arrange each explanation into conclusion and hypothesis formation. But at this stage, suddenly the student realized that no, what they were explaining was not correct. They can go back to the brainstorming session again. They can go to the key problems again to modify their hypothesis. There is nothing wrong with them. After they have made their hypothesis, they will formulate their learning issues. They will research resources for self and group study, and the further discussion will be done in the second session and the case or the final session. If it is a 3-session process, the same process will be repeated in the second session, and if it is the 2-session process, they will do the further discussion and the case closure is done. After the case closure, the evaluation of the group performance, self-evaluation, and reflection is being done. What is the purpose of the clarification of terms? The objective is to understand the trigger. Students read the written problem or the scenario. They identify the difficult terms and find their meanings, and they understand the scientific terminology. It is very important that sometimes the student think that they know the scientific terminology, but when you ask them what does it mean, they don't know. So it is very important that the students are directed to find the meaning of the scientific terminology through the medical dictionary. Key information, key problems and issues. Objective is to recognize the cues and key points and to promote thinking ability and problem solving skills among the students. Discuss the complaints and or the issues which are there in the trigger. List the identified facts and the problems, or prioritize the problem issues for learning purposes. Generation of ideas, brainstorming. Objective is to understand the possible mechanism that might explain the feature of the problem. Activate the existing knowledge and identify information gaps for better understanding of the issues. Assess what is previously known by critical analysis. Activation, elaboration, hypothesis text is important over here. As the preconceptions are activated, the students are able to identify the gaps in their knowledge through self-study, discussion with peers, and responding to questions, thus enabling them to be the better learners. Motivational process supports these cognitive changes. They also require active discussion and involvement of all. The biological, psychological, and social aspects of the problems are discussed. The local context, the legal and the ethical issues related to the problems are also discussed. That will develop, and the students will also develop the concept map in the process. Hypothesis generation objective is to help students focus their inquiry and become aware of their limitation and to promote effective reasoning and STL. The inquiry process involves asking questions, observing, probing, examining, and testing. Without hypothesis, students collect unfocused data. When they don't know what is actually the problem, and the data they will collect will not be focused on the issue, and they will collect everything which is related, which they think is related. Discrepancies, confusion, and misunderstandings may occur during that stage. Data often is disorganized and incomplete. Facilitator assists in metacognition and management skills. Periodically, the facilitator asks to review and synthesize the facts and ask others to amend and improve the synthesis. As the missing informations are provided, the student amend their hypothesis during the process. Identification of the learning needs. Objective is to identify the key deficits in knowledge and understanding. Learning needs are prioritized into must know, individual learning needs, and good to know, which are the group learning needs. The studies reveal that 64% of the learning needs identified by students and faculty they matched. Many non-intended learning needs generated by students were also relevant. So practically sometimes students phrase these learning needs as questions. All students will study all the learning needs. It is must in undergraduate. In postgraduate level, the students will study 2 to 3 major learning needs, and rest of the learning needs are distributed, or they divide the learning needs among themselves. But for undergraduate, it is recommended that all the learning needs must be, which are the must know learning needs, must be done by all the students. Resource search and active learning. Objective is to have a sound knowledge and understanding of the issues identified as learning needs. The situational interest hypothesis describes that the nature of the problem creates a desire to search different resources and to continue to seek relevant information till the new information related to the problem is obtained to the satisfaction of the students. Very interesting hypothesis. That means that if the problem is interesting, then the students will show more interest in the learning process and they seek the information. This leads to enhanced concentration, focused attention, and willingness to learn. Students work as team or individually and meet as group in between 2 sessions to discuss all those learning needs. A list of resources is provided to the students. However, the students are free to collect information from whichever resource they want to. Students need to learn information processing skills as well, short-term memory and long-term memory, so that they can have this information stored in their brain for further use later on. The second session, the final session, will be on the discussion presentation. The objective is to share new knowledge and its application and to develop communication and verbal presentation skills. Integrate the newly acquired knowledge into the context of problem through discussion, charts, diagrams, concept maps. Co-construct their knowledge through co-elaboration, how different they should have thought and analyzed the problem. Develop strong reasoning, communication, and team building skills. This is followed by the closure. The objective is to close the loop, the loose ends. Discussion of the next steps taken in the further management of the problem is take place during this session. The facilitator may require the students to communicate their findings and recommendation orally or in writing. Debriefing session. Objective is to evaluate both the process and the knowledge acquisition for reinforcement and constructive feedback. help the student to know their strength, identify their weaknesses, help in self-reflection and improve their performance. Components of the debriefings are assessment of self-performance, both by the students and the facilitator, assessment of the group activity, both by the students and facilitators, assessment of the facilitator role by the students. The achievements which have taken place, where were the shortcomings and how we are going to amend this. Reflection is what further could have been achieved in this session. Group behavior and professionalism is also discussed during this debriefing session. Issues associated with the process, exploration of problem and clarification of terms, the step is missed. The student directly jump to the next step, and that means that they don't know exactly what the problem is, and then they will provide wrong explanation and expect the facilitator to explain to them. Identify key information as issues, ill-defined problem statements, and miss out important information. Generation of ideas and brainstorm, picking keywords only without critical reasoning, cannot come with potential explanation, and the learning is very superficial. The hypothesis generation, unable to see the pattern, unable to criticize, to critically analyze the problem. Formulation of learning issues, question formulation is vague and unfocused. This is the common problem because the students generally say, for example, the learning issue arises is anatomy of heart, which is a huge topic. So if the patient is with the myocardial infarction, probably the more important would be to know the blood supply of the heart, not the whole of the heart. If they come to this learning need that it should be the complete anatomy of the heart, then probably they have a lot of learning to do during the in-between time. Search resources and self or group study, problems with time management. Usually the students this is understandable because usually the students have other classes also and they have to manage their time very, very well. So in the orientation week, while we are teaching them how to be a PBL students, we teach them some tips on time management as well. Read text superficially, get material from the seniors, and lack of commitment to the PBL are some of the reasons, issues with the process. Further discussion and case closure, exchange factual knowledge with no correlation with the case. The patient in the case is totally forgotten and they will just discuss the knowledge which they have learned and then go out. Hesitant to challenge material shared by others, protecting their own fellows. Lack of motivation for discussion, follow the divide and rule strategy. Evaluation of the group performance, self-evaluation and reflection. There is a superficial feedback given by the students or the facilitator, reluctance to say anything bad about their peers, and the time constraint when there is not much of a time and the feedback session becomes very, very superficial and very, very short. At the end, this is one of the PBL evaluation form which I am sharing with the members because some members have asked that how do you evaluate the PBL form. I've gone through a few of the PBL forms and almost all of them have the same sort of a pattern with the questions might be a bit different from each other. You will see that mainly the thing is on the communication and team skills and the critical thinking skills and reasoning skills, while the component of the content is not very much in discussion. The only thing is whether they were able to participate in the process or not. Thank you very much.
Thank you very much.
Any questions are welcome, please.
May I start, Professor Rashid Mahmood? Hello.
Hello.
Hello, I am Professor Rashid Mahmood. May I start with the...
My name is Matsuo from Osaka, Japan. May I ask you one thing?
Yes, any questions, please?
Yeah, I'd like to ask one question.
Yes, Dr. Osama?
Okay, thank you. Thank you for your very big talk. And when we are talking, the early part, I found that the facilitator should take
Sorry, Dr. Samu, we cannot hear you.
During your talk, you said that the facilitator should take a chairmanship. But I don't think so, because chairman should be students and not the facilitator. So the role is very different for me. How do you think about it?
The facilitator is facilitator and the chairperson should be from the students. That is what you are suggesting.
Yeah.
That is what we all think of. But in some of the literature which I have searched through while preparing this, it was mentioned that the facilitator can be a chairperson as well, which I just wanted to know if somebody has this sort of arrangement, how it works.
I think that all the discussions should be on the student side.
True.
Yeah, not interfered by the facilitator.
Maybe Dr. David Kwan is here. He can give some idea.
Yeah. I like to say it because of listen to many of them. I think one must emphasize the spirit of PBL is a student-centered learning. Student-centered learning means student will manage it. If student will manage it, that means they should be the chairperson. I agree with Osamu. But again, our understanding of chairperson or director, all these terms are very, very vague. So you will definitely see a lot of these terms in the literature. Yeah, but you have to read literature carefully. Not all published data are correct.
True.
Yeah.
Okay.
But I agree with Osamu.
Thank you, Prof.
Thank you.
We don't allow the students, the facilitator, to become the chairperson over here in Malaysia as well.
Okay.
Yes, Prof. Prof. Aslam.
Yes, please. Now, self-directed learning has a definitive role in promoting problem-based approach. But is there any role of team-based learning in enhancing problem-based approach of learning?
The collaborative learning is there.
Yes.
May I address that point?
Yes.
The team-based learning and the problem-based learning are two totally different things. Their purpose is different. Their aims are different. If you look at the PBL, there are so many skills which students would learn during the process, and the TBL does not give them that opportunity. So I don't think TBL can replace PBL. In fact, they are totally two different things. There are positive points for TBL, but there are a lot of other positive points for PBL, and TBL does not address all the points which PBL does. So I personally, I think there is no comparison between the two.
Right. Thank you very much, Dr. Alam.
Yesterday, Professor Hawaii, Professor Leslie Tam also gave a webinar. And so he touched upon also this issue, team-based learning. And he said, he definitely saying that team-based learning is not the way, because team-based learning, the basic unit is team. PBL learning, basic unit is a student individual. So we would like to train the student individual, but student individual, they work as a team because they call it small group learning. So team-based learning on the team. So what they do in the team-based learning at the end, all the students in the team must agree with one correct answer. Totally against it. And this answer, who gave the answer? The standard answer was given by the faculty, because so many different teams was governed by one tutor, just like a big class, one teacher. Why they do that? Because it saves resources. They don't need so many tutors. So I myself, I don't believe in team-based learning.
Assalamu alaikum.
Walaikum assalam.
May I ask a question? Or not a question, but a comment.
Sure, please.
This is Imad and from Oman. And I've noticed that in one, thank you very much for your informative presentation, by the way, it was so informative. In one slide, there was a statement that says teachers has to be highly motivated. And in fact, the word teachers, I don't think it works very well here, because you are talking about a facilitator job. So I would suggest that this could be taken out and replaced by a facilitator.
Sure.
Thank you.
Thank you very much.
Yeah, I think that's absolutely right. We are talking about facilitation, not about teaching.
You cannot set a question, just a few comments. Number one,
yes, Professor. Yes.
Presentation, and we have been conducting the PBL sessions in our institute for the last few years, but we got many. But there are some limitations I want to point out. And the first slide was
Prof, cannot hear you clearly.
In our setup, there are very less number of senior faculty, and this is mainly conducted by junior teachers, and there is a lot of turnover of junior teachers, and they generally come for the preparation of their FCPS, and they leave after a few months. So the motivation is a big issue. And in addition to the motivation, the total number of faculty required is more in this sort of teaching. That is also an issue in many institutes. Another challenge or issue is that in many institutes there are non-medical faculty, and you know that in this setup, in this instructional strategy, there is a lot of clinical reasoning. Even the faculty who are not MBBS, who are BDS, they face problems to tackle with the students. So what we've said in non-medical, so the BDS faculty and the non-medical faculty, they are having issues. The fourth is the PBL room we were talking. In a class of 100, of course, you will have to make at least 10 or 12 groups. There's difficulty in arranging the PBL rooms with proper setup, round tables, and the lockers and books and other things and computers. And finally, as this PBL is generally not conducted in one session, and in between two sessions, you have to give sufficient time to the students for discussion. So there should be some self-study gaps in the timetable. So you need some adjustments in the timetable. These are my
because you have asked so many questions. Let me answer them first.
Right.
Before you ask another question. The first thing is there is no junior and senior problem. In problem-based learning, it was mentioned that you don't need even subject expert. If the person has studied the facilitator guide, and obviously if it's a non-medical person teaching in a medical school, they have to make an effort to learn about medical things. So in fact, in our experience, the juniors are better facilitators than the seniors, because the seniors tend to give lectures. The most difficult thing I find during PBL is to keep quiet as a facilitator. You have an urge to speak and intervene and teach. So I don't think there is a junior or senior issue here. As was mentioned, even BDS, the other people can facilitate. Purpose here is facilitating, not teaching. I think we need to differentiate between the two. The second issue you mentioned about the infrastructure. Of course, if we want to practice PBL, we have to make some arrangements. Now, what we did, for example, in one of our institutions, we had around 200 students, but we had only 10 rooms available. So what we did, that we divided the students 100 and 100, 100 in the morning and 100 in the afternoon. So when one group was doing PBL, the other group was doing their practical or other sessions. So the timetable can be adjusted I don't think that's a major issue. The next one you mentioned is self-study time. Of course, we in the timetable we need to give self-study time. We cannot have lectures from morning till evening. The lecturers keep on changing, but students are same. So I don't think they would learn much if we keep on giving lectures. Generally, we follow about 20 to 25% time in the timetable is left for self-study. So, and once we know that a lot of things are being covered in PBL sessions, we don't need to give lectures on those things. So we can save time. So issues which are being discussed in PBL, so we should save time by not giving lectures on those, and that will give you enough time in the timetable to handle those issues. I hope I have answered your questions.
Thank you very much.
Yeah, Dr. Aisha Abdullah.
Assalamu alaikum, sir. First, I would like to congratulate both of you in getting us all together and educating us about a very important topic. I just wanted to say something about the PBL as I have experienced it. I like PBLs because of the diversity that it allows for students to deal with in terms of their ideas, in terms of their learning styles and communication styles. And students learn in ways that we can't even comprehend fully in PBL. So I think PBL is a very beautiful strategy for undergraduate students. The other thing that I just wanted to share my experience was about dealing with students who are dominating or silent in a PBL group. And I found the debriefing session to be very useful. Instead of identifying students and pointing them out in during the session, especially the silent ones, it's better to let them debrief in the first session. And I get a commitment from them for the next session that they would improve their participation with regard to over or under level of their participation. So I wanted to share my experience about that.
Thank you very much for sharing. Just one point was mentioned that sometimes students they are shy to speak because they don't have a good command on the English language. I think in those situations we should allow them to discuss in whatever local language is, at least to begin with in the initial session. So communication does not mean that it must always be in English, right? So to begin with, and especially the initial sessions, to encourage students, I mean, in Malaysia, we can ask them to, if they want to express in Bhasa Malaysia or in Pakistan in Urdu. And I think when they are explaining in their own language, their understanding is better. So, and I don't see any harm in that, at least in the first few sessions. Yes, Dr. Kiran. I can see the hand raised by Kiran Bana. All right, okay. Any other questions or comments, please?
Prof, I want to ask something.
Yes,
I am
please.
Dr. Sumair from Gujranwala Medical College, Gujranwala, Pakistan.
Yes,
Please tell me, we have a lot of junior faculty, but very less number of faculty in the basic sciences. How can we develop these scenarios? Because I think for scenarios, we should have a specialist faculty, at least dedicated and motivated faculty to develop the PBL scenarios and the guides. However, facilitation can be done by junior faculty, which is not specialist, but for developing these things, can you guide how can we develop these things with very few number of senior people, not above the rank of assistant professor?
Right, okay. I think I need to say it again that the senior and junior is not really an issue in PBL. And second is that we must take the help of clinicians in developing the scenarios. The best scenario is a case taken up from the hospital and then modified it according to your learning objectives. We take cases from the hospital, we simplify, and then the good thing is that you don't have to cook the data. The actual data is available, actual investigation results are available, and that is more realistic. So the best thing or the most effective way of developing triggers or scenario is taking help of the clinicians, taking relevant cases from the hospital and modifying it according to the learning needs or learning outcomes of the session.
Okay, thank you.
Any other questions, comments?
Assalamualaikum. I'm Azril from IUM Malaysia.
Yes.
I have a question for Prof. Roxana actually.
Yes.
Okay. Just now in your presentation, you tell us about the process of PBL, the learning cycle. You mentioned about the 7 steps in PBL. From my reading, I've come a few. They are not confined to 7 steps. There are some institutions they have 4 steps. Some use the 8 steps, and some use the 5 steps. So may I know why you choose the 7 step instead of the others? Because some institutions they use only 5 steps. Some use 6 steps.
Even use 3.
Yeah. Some use 3. Thank you.
As well, this 7th step has come from the original PBL from McMaster.
Sorry, no. Mastery. McMaster used 3 steps. They call it triple jump.
Oh,
and then mastery in Netherlands converted to 7 steps.
Yeah.
But the 7 step, 3 step is the same. It's only dependent on how refined you want to make it. But you look at it, they are all the same. But McMaster make it simple because remember 3 things is better than remember 7 things.
Yeah, simplicity is the best.
Okay.
So
as you got the answer. So it's 7 step or 5 step. If the process covers the whole process, which I've explained, then they are okay.
Okay, thank you, Prof.
Thank you.
Thank you, Prof. Roxana, and thank you, Prof. David.
Thank you.
Any other
questions? Sir, Professor Alamsher Khan, thank you very much, and Professor Roxana, a very useful and interactive learning. We enjoyed a lot. Sir, can you further explain to us that this PBL is more useful in basics or in clinicals? And in outpatient, which is the best method, PBL or case-based learning?
Yeah, okay. Now, if I were to share my personal experience, we use PBL in the so-called preclinical years and case-based learning in clinical years. The difference is that in PBL, we want to understand the problem. We don't want to solve the problem. Of course, there would be something about the solving the problem, but main purpose of PBL is to understand the problem. And while we are trying to understand the problem, we are going into basic sciences, into pathophysiology, physiology, anatomy, pathology, those kind of things. Case learning, in my opinion, is a good follow-up in clinical years. And in case-based learning, the emphasis is on problem solving. So the basic difference, one is problem understanding, other is problem solving. And in case-based learning, we give them a case and the students discuss, they apply their previously acquired knowledge and try to solve the problem. And in that process, some learning needs may come up and students learn about that. So, so that's the approach we are applying at this stage.
May I comment on
Thank you, sir. Thank you very much, sir.
Yes, Doctor.
Yeah.
May I comment?
Yes, please.
Yes, I'd like to comment on the case because the case writing is always the very difficult part for many schools. But let me put it this way. Some schools even misunderstood the PBL as case-based teaching or case-based learning. In problem-based learning, we use, in the early medical years, we use problem, but the problem need not be directly clinical, but clinical associated, but more associated with basic science. Why? Because later on in clinical years, all so-called clinical thinking, they are based on basic science. If you don't know basic science, you cannot do clinical thinking, okay? So later on, once you get to practice, so it's a problem solving ones. Then you use case-based because at that time you apply whatever you learn about the problems and then you use to practice on patients. So there are two stages, but they both are problem-based learning, but the early years we use problems. I give you one example. I developed one problem for the first and second year, Madame Curie. You know what Madame Curie is? About the radioactivity. She's the woman, first woman getting Nobel Prize and all these kind of things. And we give them this, the purpose to understand all the things behind this Madame Curie about the radioactivity, about how hard she worked on research, and about woman gender issue, woman the place in science. That is also medicine, okay? It's not just social science per se. And you use integrate whole thing. Later on, you can use radiology, cancer, radiotherapy to give to the higher year students, because at that time, you apply whatever you learn in the early years into later years. So it is a continuum. It's not a this and that and separated.
Right. Dr. Ziaul Islam, please.
Yes, Assalamu alaikum, Dr. Ziaul Islam from Karachi, Pakistan. It's a very interesting to hear all of you. I just put my one comment that running a PBL, the most important thing is the faculty training. And many problems which arise is due to lack of faculty training. And this important task has to be done by the Department of Medical Education in their respective institutions. Because until unless the faculty screen how to run the PBL, how to score it, how to give marks assessment, the exact thing but from PBL is not able to approach. So my suggestion is that training of the faculty, both the juniors and the seniors, are an important, essential part of PBL process. Thank you so much.
Thank you very much, Dr. Ziaul Islam. I think I cannot overemphasize the point you have raised, but we should not forget the student training as well. There need to be some briefing to the students in the beginning, what are their roles and what are expectations from them and what should they expect from the facilitator. So they should not go into PBL session hoping that facilitator would be answering all their questions. So facilitator training as well as student training are two very important aspects for a successful PBL. Thank you. Dr. Noreen Mirza, please.
Yes, Assalamu alaikum.
Wa alaikum assalam.
Yes, this is Noreen Mirza. I'm a medical educationist from Pakistan, Islamabad. I've been working with the College of Physicians and Surgeons as a facilitator for almost less than 2 decades, probably. And I've served with College of Medicine, Department of Medical Education at Princess Noora University. And I was heading the faculty development and faculty training unit as well. I have a comment and a suggestion. I must appreciate the wealth of knowledge that we have received in this session. It was really immense. The other thing that I wanted to share was that while I was at Riyadh in the college, what we used to do is that we would arrange obviously different sessions for our faculty, all different kinds of faculty, junior, new faculty, clinical faculty and others as well. Somebody just mentioned about writing the cases, and I will agree that writing the case which would lead the students towards the right direction is really a skill and an art as well. So Dr. Alamsher, my humble suggestion would be if you could probably arrange a session like a workshop, how to write We have done that in Saudi Arabia many times. And if you want, I can give you the reference of the professor who would do that wonderfully in Riyadh. So that is my suggestion.
Yeah, thank you very much for the suggestion. I think it's a good idea and we will try to take up that. Thank you. Dr. Noor Jahan. Yes, Dr. Noor Jahan, you have raised your hand. Please, please unmute yourself. You have to unmute yourself.
Yes, thank you very much. Assalamu alaikum. This is Dr. Nasreen Jahan. I am an ex-faculty in Cyberjaya University in Malaysia. So what we found actually, we had a PBL bank actually. PBL bank was created with well-written PBL sessions. So sometimes due to the shortage of writing a new case, often we reuse from the PBL bank, update it, modify it, and reuse it. And that can save a lot of time. And that is very useful, I have seen in our university. So that I suggest sometimes you can highlight how to make best use of PBL bank. Thank you.
Dr. Nasreen.
Yes.
Can I make a comment over here? We also use the old PBL packages, but usually the tendency of the student is that they borrow the learning which their seniors have done.
No, that is only for the facilitators has access on that, not the students actually. This PBL bank is used for the facilitators. In case we can't create the new case scenario, new package, facilitator guides, shortage of time and this and that, shortage of faculty. In that case, we can use it from the PBL bank, but a student has no access to the PBL bank. They don't have. So we can.
I'm taking it from a different perspective. If the case has been used, say for a year 2 students, and when the year 2 students move to the year 3, they will give all their learning outcomes to the new year 2 students.
I know.
They pass
that is okay, but we can modify. That is the thing.
Technically what we do is, Dr. Nasreen, technically what we do is that we don't use the same PBL package for two consecutive years.
We do not use exactly the same. We modify it, rename it, and redo the thing with an expert from the faculty who knows the package was done last time. We never use the same title, never use the same case. We can modify, we can adjust, we can improve and update whatever it is. So I think that is okay. We can do that way also. We have done actually. We have seen it is not bad. Sometimes it helps when there is acute shortage in faculty, lack of time, other priorities and this and that.
I think
so
Professor
you
David
can
Kwan has some comment on this. Professor
May I add something to it?
Sorry, Professor David Kwan has some comment on this, please.
Yes, I love to comment on this because I've been doing almost like 100 workshops on how to write PBL cases, and also if you can see, I don't know whether you can see from my screen. Can you? Oh.
We can see the beach.
You cannot see me, right?
Yeah,
we can. Yes, I can see.
We can see you, David.
Oh, you can
we
see
can
me.
see. We can see.
But I cannot see. I can somehow I touched on something. But can you see what I pointed out?
Yeah, beautiful.
Okay.
Excellent view.
These are the cases.
Yes.
We have about 200 or 300 cases accumulated. Now with and they all reviewed. Okay, they have been reviewed, criticized, and rewritten. And we have a pile of this. And we have pile of this, and we can choose any of this at any time to give it.
Yeah.
And at McMaster, I have used a case for over 10 years. Okay, so that resolves some of the people's worry about the same case is used. I can tell you, maybe McMaster students different, but they don't go to consult a senior student to say, at that time, what have you done? Can you give me? They don't do that. They are working on their own. Honesty is one of the characteristics in PBL we ask a student to stick to. So they don't do that. Even you give them some of the information, they say, thank you, professor, but we can find our own. We don't really need it, but we love to look at it if we cannot find it. So this is the success of PBL. If your student cannot do that, you still have some way to go. But having these cases and repeating the cases is not a problem. Not a problem.
I see Prof. Leslie. Prof. Leslie.
Yes.
Yes.
I don't know how to work this to raise my hand, so I apologize. But I wanted to thank Professor Malik for such a comprehensive and thorough guide. And I wanted to make comment about reusing cases because at Hawaii, we use the same case over and over and over again. Now, I gave the example of the spirit of problem-based learning on our WhatsApp group. I said the student was hurrying for her afternoon tutorial and she was walking past an acquaintance in the morning tutorial, and that acquaintance said, hey, the case today is, and the student said, don't tell me, I don't want to know. She was saying that if you tell me, it will spoil the whole PBL process for me. She has confidence and excitement that she's going to go in and with her tutorial mates, they're going to solve the problem. And so she did not want to know what the case was beforehand. So I think that has been ongoing for a long time now. We've been using the same cases over and over again.
Unfortunately, Prof, we have a different experience, and maybe there are some cultural differences as well. So I think the situation may be different in different parts. Yes.
It may be, and I think part of that is that McMaster told us to introduce a pass-fail curriculum. So the students are never competing with each other. They either get pass assessments or satisfactory or unsatisfactory or borderline assessments. So maybe that is part of the reason it's cultural or introducing pass-fail. I think that added a lot to being able students to feel that they weren't competing with each other.
Right.
Also the selection
Dr. Aisha Abdullah has raised her hand.
I just wanted to respond to the problem that everybody's raising with regard to generation of PBL packages. The way we have dealt with it, we conduct the writing of PBL packages as a workshop with one clinician and a team of basic sciences. We make it kind of a celebration with some lunch and everything. And then we acknowledge teachers who take PBLs and teachers who create PBLs, and we consider it in their promotion as well.
Yeah, that's a good idea, and it has been practiced in some of the institutions in Malaysia as well. In one institution, the criteria was that if somebody has written 4 PBL, packages or guides, that would be equated to as one publication in their promotion. So I think that's a good approach.
Yeah, but for us in Cyberjaya University, we used to make it compulsory for all lecturers to do by rotation, so that everybody can learn the process and get the skill. Not that some people are getting promotion every year and every time, others are left behind. So we give the opportunity to all lecturers, and sometimes the skilled one helps the new one to develop it. So it is a teamwork, but leadership is borne by each lecturers individually rotating together. So that gives the opportunity of making bigger skilled people in the whole team.
Thank you. Thank you. Dr. Asif. Dr. Asif wanted to say something. Yes, Prof. Deborah.
Oh, sorry.
Yes.
Continuing with what Prof. Kwan and Prof. Leslie have mentioned earlier about this using the same case. I happened to be in McMaster, sat in Prof. Kwan's group before and saw how their students work. And I also had 1 month time with New Mexico Medical School and saw how their students work. And it is true, their students do not look to the seniors to find answers. So there may be some element of culture. They are not worried about not knowing the answers. They are quite happy to work on the problems themselves. So with that kind of experience, when I went back, when I was in Malaysia, trying to then introduce PBL with Prof. Kwan's help at that time, I then have to, like you said, have to train the students to understand the philosophy and explain to them that we are not looking for answer, and it doesn't really give them any credit by knowing all the answers if they've got them all from their seniors. And I guess if we can train our students to understand that better and better each time, they may then adapt themselves. And we have been using also same cases for the last few years, but now we have to change because those cases belong to other university. So we have to make our own cases. So we are making new cases. But we've noticed that even though we've been using those old cases for the previous years, initially there was no problem. But I think in recent years, we're beginning to see students are trying to actually get from their seniors. But we can change their mentality.
Thank you, Prof. Dr. Uzma Sohail.
Assalamu alaikum. I am working as assistant professor in DME department in a new medical college. It has been working since last 3 years, and I am facing the difficulties in faculty development program because a new medical college has faculty that is not much trained, and to start PBL there. Can role play be used for teaching them how to conduct PBL?
Yeah, I
can use role play.
Running a mock PBL to train the faculty probably can be used that. But Dr. Uzma, you have raised an important point. In my personal experience, many institutions where they had problems with the PBL was not problem with the PBL, but getting the preparation for the PBL. If we don't train our facilitators properly, then we are bound to fail. So either we do it PBL or we don't do it. There's no middle way there. So training of facilitators, training of students, preparation of facilitator guides, it's must. Unfortunately, there's no shortcut for that. Dr. Shahreen Zahid Khan.
Yes, sir. I'm Dr. Shahreen Zahid Khan from Pakistan, Associate Professor in Dental Materials. I wanted to ask I wanted to add one thing, that is that, if we have shortage of people who can create these things, in case we have that, then we can involve general practitioners, either from MBBS, if this is developed for MBBS faculty, or BDS, if it's being developed for BDS faculty, because general practitioner is seeing all kind of cases. So we can involve that. That would reduce, the problem of involving the senior faculty, but definitely that general practitioner should have at least experience of 5 years. Secondly, we can also accommodate the published cases that are already available in the form of books or the recent publications. The published cases can be modified according to our basic sciences topics, and we can utilize that for the starters. Definitely, it is always better to create your own case, but sometimes you can get published and good cases who've been through all the modification when they're coming and being published in the in certain good journals. So I think that that can resolve this shortage of the cases in PBLs.
Thank you, Dr. Shaheen, but you can combine your BDS and the MBBS lecturers to run the show. So,
yes.
So it's not necessary that only MBBS can run the show. Okay,
Yes,
Dr. Kiran Bana. Yes,
Hello.
Prof. Debra.
Can you hear me?
Yes, Dr. Kiran, can hear you? Yes.
Yes, can you hear me?
Yes.
Yes. Thank you very much. This presentation was very informative, and I'm from Karachi, Pakistan. My question is that due to this pandemic, what about the PBL, what we are conducting on a remote setting? Is there any difference of steps? And other important question is that how can we assess the team building skills during remote setting?
Yeah, I mean, this is unfortunate, the situation, and we have to cope with it. We have also tried the PBL online, and of course, there are certain limitations. So we use Zoom, and we use their room, what they call it, the breakup rooms. And the number of students is same, and the facilitator is there. Most of the things can be done, but as you said, there would be some limitations because it's very difficult to replace face-to-face with online. But under the circumstances, I think that is the solution we have to follow. And we have been trying to do this by using Zoom and breakout rooms. So one facilitator, and because there is a screen also they can share. So I mean, you have to cope with that situation, unfortunately. Prof. Debra, you wanted to say something?
Yes. I wanted to follow up on what Dr. Shaheen has mentioned about getting GPs involved. And I think in United Kingdom, I think they have been trying that, and they said that in fact the GPs are quite willing to come to take part, and they are quite proud, especially if they have a certificate put on their clinic saying that they are part of the university's academic staff. But one of the things that they did mention is that we need to also train the GP to understand the educational purpose of that case. So otherwise, they may write up the case more like a problem-solving kind of session. And it's the same as when we ask our clinician, our senior consultants to write cases for our PBL. When they first wrote it, they said they didn't understand it. So after we briefed them, they said, now I know why you want to develop the case and how it should go. And we feel therefore that it's also necessary to train our consultant, our senior clinicians who are writing cases for us, so they understand PBL philosophy and they're not just writing it up for the normal case study, case presentations.
Yeah, I agree. They have to be trained. Okay, many people got the wrong impression, thinking clinician is best person writing PBL cases. But to the contrary, my experience, wait a minute, okay, in 20 years, they are the worst. Because if they don't know about PBL, they just pull it out a case from their shelf and then start writing up a story. They don't know about how this relates to the curriculum. They don't know this should be related to the population or behavior perspective. They just write down the clinical syndromes, drugs, and all that kind of things. It's terrible. So they have to be trained.
Yeah. Can I add something here? Excuse me.
Yes, please.
Yes. What is my point actually? Any new lecturer who joined here, beside the GP and other things that you said to involve, the process orientation is very important for a new lecturer or outside the faculty to observe first. First, they should observe as
we lost you, Dr. Nurjahan.
Facilitator.
I think we are coming towards the end. There's time pressure as well. I must thank everybody for your contribution. I have to share 2 slides before we close the session. The first one is our next webinar, which would be on 22nd of August, and it would be on OSCE and OSPI webinar. And we will be sending the relevant information. The second, my usual appeal as a charity drive. So I request and propose to each participant to donate $1 USD or equivalent amount in your local currency to any deserving individual in your neighborhood or any public welfare organization. So this we do for our each webinar, and I hope that the members would contribute in this charity drive. Thank you very much for everybody for your cooperation and attention. I'm sorry we could not entertain some of the questions, but we will be happy to answer them through our WhatsApp. So please, if your question has not been answered, do write to us and we will answer as soon as possible. Thank you again for your participation and have a good evening.
Thank you, Prof. Alamshir. Thank you very much.
Thank you.
Thank you.
Thank you.
Bye.
Thank you.
Thank
Bye-bye.
you.
Bye.
Thank you, Prof. Roxana.
Thank you very much, Prof.
It's a pleasure to have you all around.
Thank you, Prof. Thank you very much. Thanks, Prof.
Thank you for the guests.
Thanks, Prof. Roxana and Dr. Koshia.
Yeah.
Thanks.
Yes. Thank you, Prof. Ghosh.
Thank you, Professor Ruxana.
Thank
Alhamdulillah.
you. Thank you very much.
Please do send us your feedback.
And we often receive figures that would need to post office. So in case that